ओम थम धन्वंतरे नमः। कर्पूरगौरम करुणावतारम संसारसारम भुजगेन्द्रहारम सदा वसंतं हृदयारविंदे भवं भवानी सहितं नमामि. Let me share. Today's topic is study on lumbar puncture for diagnostic purpose like meningitis, encephalitis, and infection in intracranial pressure, increased intracranial pressure conditions, and also in treatment like in anesthesia. Anesthesia, the lumbar puncture is used. This is the lumbar vertebrae between L2 and L3 in the spine. We are inserting the needle, spinal needle, and into the epidural space, subdural space, and we are taking the CSF, cerebrospinal fluid, and it is collected in a vial, sterile vial, and is sent to the laboratory. There we are getting the analysis of the CSF, cerebrospinal fluid. Based on that, we can diagnose whether it is viral meningitis, or bacterial meningitis, or tubercular meningitis, or other conditions. In treatment also for giving anesthesia, we are doing lumbar puncture and we are injecting the anesthetic drug into the spinal canal. Lumbar puncture with examination of cerebrospinal fluid is an important diagnostic tool for a variety of infectious and non-infectious neurologic conditions. Although there are no absolute contraindications to perform the procedure, caution should be used in patients with 1. Plausible raised intracranial pressure with risk of cerebral herniation due to obstructive hydrocephalus, cerebral edema, or space occupying lesion. 2. Thrombocytopenia or other bleeding diathesis, including ongoing anticoagulant therapy. 3. Suspected spinal epidural abscess. In these conditions, lumbar puncture is contraindicated. Procedure of the lumbar puncture, procedure technique. Local anesthesia with lidocaine is injected into the previously identified lumbar intervertebral space, and 20 or 22 gauge spinal needle containing a stylet is inserted into the lumbar intervertebral space. The spinal needle may be advanced slowly, angling slightly toward the head as if aiming towards the umbilicus. Flat surface of the bevel of the needle should be positioned to face the patient's flanks to allow the needle to spread rather than cut the dural sac. It is the fibers of which run parallel to the spinal axis. The approximate distance of the epidural space from the skin is 45-55 millimeter on average, but is variable and may be longer in patients with obesity. Lumbar puncture can be helpful when trying to confirm or rule out the conditions like the following. Number one, meningitis. There is inflammation of the membranes covering the brain and spinal cord. Number two, encephalitis. This is inflammation of the brain tissue system. Number three, bleeding in the brain. Number four, dementia. Number five, myelitis. This is inflammation of the spinal cord. Number six, leukemia, cancer of the blood. Number seven, autoimmune diseases such as multiple sclerosis. These are all indications. Lumbar puncture can also be used for treatment. For instance, such as local anesthetic, antibiotics, or cancer medications can be injected through the lumbar puncture needle. This allows the drug to enter the nervous system directly instead of through the bloodstream. When local anesthetics are given this way, it is called spinal anesthesia. Now let us see the complications of lumbar puncture. Lumbar puncture is a relatively safe procedure, but minor and major complications can occur even when standard infection measures and good technique are used. These complications include post-lumbar puncture headache, infection, bleeding, cerebral herniation, minor neurological symptoms such as radicular pain or numbness, late onset of epidermoid tumors of the thecal sac, and back pain. These are all complications. Post-lumbar headache, lumbar puncture headache, infection, bleeding, cerebral herniation, minor neurological symptoms such as radicular pain or numbness, late onset of epidermoid tumors of the thecal sac, and back pain. This is a procedure. You can see the area is covered by surgical cloth and the area is kept open where the lumbar puncture is done and the needle is passed. You can see the area L2 L3 disc intervertebral disc L2 and L3. Between that intervertebral disc, the final needle is passed. It is passed towards the abdomen and slowly we are feeling the resistance when the needle opens the ligament in front of the spinal canal. Then we feel the resistance relief. Then if you remove the worker, then the CSF will come out. Now, see, L2 and L3, the space, we are passing the needle into the spinal canal. So it's below the third eye can, okay, and clear area is lumbar puncture between the L2 L3, sometimes L3 L3. We are passing spinal needle and taking fluid, cerebrospinal fluid. You can see needle is passed, spinal needle is passed into the particular space, L2 L3 level, and the cerebrospinal fluid is collected. We can have the idea about the cerebrospinal intracranial pressure by seeing the flow of CSF in the needle. Drop we can. So you see the area of the L2 L3 over this space, the needle finally is passed and the cerebrospinal fluid is tapped, is taken out. It is stored in a vial, sterile vial, sent to the laboratory for routine and microscopic evaluation. So depending upon the protein content, chloride content, sugar content, and the cells, neural cells, we can identify whether the cause is viral, whether it's viral meningitis, or bacterial meningitis, tubercular meningitis. suspect of rheumatoid meningitis, you have to go for AFP, comes positive, cause of meningitis is tubercular meningitis, tuberculosis. So we have to correlate with the symptoms: headache, vomiting. This is a patient undergoing lumbar puncture. You can see the needle is pricked and the CS is collected. Lumbar puncture, stroke. You can see how the lumbar puncture is done and collection of cerebrospinal fluid is done. The needle is passed in the intervertebral space of L2 and L3. The position, left lateral position, you have to make the patient lie on the back and thighs and head is bent towards forward so that the intervertebral space is more widened. Then the needle is passed. When anesthesia is given locally in the skin near the area and the needle is passed. The patient undergoing lumbar puncture. We have already punctured the spinal canal and we are collecting the cerebrospinal fluid. The diagram shows the cerebrospinal fluid analysis, how it is done. Okay. So the spinal needle is passed in the L2, L3 intervertebral space and the spinal canal is punctured and we are getting the clear fluid. The fluid is sent to the laboratory for analysis. Another picture which shows the lumbar puncture. So the patient is made to lie on the left lateral position and the leg, thighs and head is flexed so that the intervertebral space is widened and we are functioning at L2, L3 level. Another picture shows the lumbar puncture being done. See, the area of puncture is open, kept open from the surgical floor and anesthesia is given in the area and after that we are puncturing and canal. Diagrammatic representation of lumbar puncture. You can see the doctor is sitting behind the patient and puncturing. The picture which shows the procedure of lumbar puncture. Patient can lumbar puncture is going. Okay, the area of prick is disinfectation is done. Here are medical and we are giving the injection of lidocaine locally anesthesia and after that we are puncturing with the spinal needle. Another patient doing lumbar puncture. See the position of the patient and the site where the puncture is done. So already puncture. The other patient is undergoing lumbar puncture. So by sitting also can do. So after puncture, we are collecting fluid sample in a file. This is a figure showing the vertebral column and intervertebral disc. Here is the patient doing lumbar puncture, undergoing lumbar puncture. So the second and third intervertebral disc space we are taking. After the puncture, we are collecting a sterile vial and sending to the laboratory for analysis. Analysis, we analyze sugar content, chloride content, and for the electrolytes and inflammatory cells also differentiating type of cost. These are the instruments for the procedure. Another patient is undergoing lumbar puncture. Area of puncture is the picture that shows the structure of the vertebral column. These are the references. So, today we have discussed the procedure of the lumbar puncture, indications, contraindications, and complications. It is used to differentiate causes of meningitis, encephalitis, tumors, increased conditions of increased intracranial tension, and also in anesthesia. Thank you for patient